saying that health is wealth. And on our health talk today is with me, I guess we can Mr. Ayodele Owoade Emmanuel. Good day, sir.
Good day, ma, and
Can
good
you-
morning.
Can you please greet our viewers at home?
Good morning, viewers. I am Owoade Ayodele Emmanuel, a medical laboratory scientist.
Thank you. Now, to start with, we're talking about infection diseases and its trend. How can we best describe the word infectious?
Infectious diseases, as the name implies, they are diseases that can spread in our neighborhood. In fact, it can spread from the host to others that are not having it. These are diseases that spread faster and can also kill.
Interesting. Sir, can you please give us example of this disease that can kill?
We have many type of diseases. For example, we have cholera. We have these diseases that is trending these days, COVID-19. We have tuberculosis, and we have sexually transmitted diseases such as HIV, hepatitis.
Okay, right. Now, like all these diseases you've mentioned, does it have a particular time where we can say this one has become infectious? Take for instance like cholera. Can we say when can we actually say it's infectious?
Normally, cholera is a disease that usually comes as an outbreak, and this occurs as a result of unclean environment. When our environment is not tidy enough and there is no clean water and the environment looks so dirty, all this can cause outbreak of a particular infection known as cholera.
Thank you, sir. Now, talking about infectious diseases, which you rightly enlightened us about, what are the factors that can spread these diseases?
There are many factors that can make disease to spread, especially from the host. There are some hosts that when they carry a particular diseases, they do not show clinical manifestation. That is why when you are having any signs and symptoms, the first thing is to go to the hospital to meet your doctor. Why the doctor will recommend that you go to the lab to do a test so that the disease can be ruled out. And if this disease is ruled out, it is advisable that you leave your neighborhood to the hospital till you are properly taken care of in order to prevent the spread of these diseases.
Thank you so much. Now, I also want to you said something the other time like clinical manifestation. Okay, so is it until they go to a lab science, as in they go to check before they can detect, or how?
When we are talking about clinical manifestations, we are also talking about signs and symptoms. There are some infections that the signs and symptoms are related. In any diseases, the first signs and symptoms we usually observe is headache. Let's say you're having malaria, you are getting down with chronic hepatitis, HIV, cholera. You may be having symptoms of malaria. And to some people, when they're having symptoms of malaria, they go to the chemist or medicine store to take OTC, over-the-counter drugs. And before we get to know, they take antibiotics, they do drug abuse. And all these things can lead to antibiotic resistance, in which when the infection is ruled out, it will be difficult for such individual to be properly treated. So to prevent this, when you are having any signs and symptoms which is an indication of infection or diseases, you go to the hospital and you present those signs and symptoms. Then the doctor will recommend that you go to the laboratory to do a test depending on the signs and symptoms you presented. So it is the test that will now rule out what is actually wrong.
All right, thank you. Now, I would like to know, are there any challenges that are related to infectious diseases?
There are many challenges related to infectious diseases. We have challenges like in our neighborhood. Take for example this COVID-19 that is outside. Some people do not believe that there is COVID-19, and COVID-19 is still existing till date. And the challenges is that people are not taking responsibility by using their nose mask, using hand sanitizer, washing their hands regularly, and this thing can lead to outbreak of this infection again, and these are part of the factors that are aiding the spread of these diseases.
Thank you, sir. We would like to go for a short break. I hope you're enjoying this program.
Yes, and
Stay tuned. Don't touch the dial.
Emac Online TV is here to provide you with opportunities to showcase your talents, business to the wide world. Are you a minister, music artist, comedian, school owner, business owner, and so on? Call or WhatsApp our marketing department on 080 5359 0094 or 081 04 02 40.
Welcome back. You're still on to Emac Online TV. If you have missed out, we're still talking about infectious diseases and its trend. Still with us is our guest speaker, Mr. Owoade Ayodele Emmanuel. Sir, before, for those of us that missed out, we were talking about the being of infectious diseases. We've talked about the challenges, we've talked about the factors. I would like to know, apart from the present one that is trending now, are there other trendy diseases, infectious diseases?
yes, there are many trending infectious diseases. Take for example, we have the tuberculosis. Tuberculosis is caused by a bacteria known as tobacco bacilli, and this tuberculosis is airborne diseases, which means if somebody is carrying that tuberculosis and the person coughed out or sneezed, he can successfully transmit that infection to the surrounding environment. So, and we also have the sexually transmitted diseases. We have the HIV, human immunodeficiency virus, and we have the AIDS, HIV/AIDS. HIV is the infection when someone is just infected, but the AIDS is the latent stage when it turns to diseases.
Thank you, sir. So I want to know, you mentioned epidemic the other time. Is there a difference between epidemic, endemic, and the pandemic?
Yes, there is a difference. There's a
Kindly enlighten
difference.
us.
When we say something is endemic, it means it is a normal diseases that is occurring in a neighborhood, particularly in this Nigeria. Whenever you visit the hospital for anything, the first thing the doctor will rule out is that you should go to the lab and do FBCMP, that is full blood count and malaria parasite, because malaria parasite is endemic in this part of the world. And when we say something is pandemic, that is an outbreak of a particular infection in the whole world, like coronavirus. Now coronavirus is successfully existing in the whole world. That is pandemic. It is an outbreak of an infection in which, if we take responsibility, we might get rid of this infection.
Alright, I'd like to stop it here today.
Right?
That I would have loved to go into like the government sector, what the government are doing about those that are into this field.
Right.
If you can just give us just a little tip.
The government are trying their best to ensure things are put in place. Like all profession, they have their regulatory body. It is the regulatory body that sees to the conduct of what is happening in each profession. Like for the medical lab, we have Medical Laboratory Science Council of Nigeria, and the role of the council is to ensure that we are having standard laboratory across the federation. Not only standard laboratory, accredited laboratory, and we have medical laboratory scientists licensed that are working there. And in this field, we have many branches. We have the chemical pathologist, the microbiologist, the hematologist, the histopathologist, immunologist, those that study forensic science, and the others. So the Medical Laboratory Science Council sees to the development of each laboratory scientist by carrying out a continuous professional development program, and to see that every one of them, they are up to date in their duties.
Thank you so much for your time today. We really appreciate you.
Thank you. You're welcome.
And to our viewers at home, we want to say thank you for joining us, for staying tuned with us. We've heard it all that headache is a sign of various illness. So don't go over the counter for maybe when you feel like headache, give me no. That should be cut. Let's go to the clinic where the necessary things can be done. We hope you have enjoyed our talk today. For more